Hello, sir. How are you?
Good, good. How are you doing?
I'm also doing good. So, sir, please introduce yourself.
So I'm Dr. Tarun Jindal. I'm Head and Senior Consultant of Uro-Oncology and Robotic Surgery at Apollo Super Speciality Hospitals, Kolkata.
Oh, great. So, sir, why did you opt for this specialization and also share your professional journey till date?
Right. So I practically am a very lazy person. So the choices of super specialty lies in neuro, which is a very demanding job. Cardiothoracic, again, a very demanding job. So I made a conscious decision to choose Euro, which does not have that many emergencies. So that was the reason. Jokes apart, I mean, urology is probably one of the most, I would say, the most technically upcoming branch in which you have major technical advances happening. Though we have just 4 or 5 organs which we deal with, but still the surgical advancements, the technical advancements, the miniaturization of surgery, this is something which is happening on exponential levels in urology. So this was probably the reason which charmed me towards urology.
Oh, nice. So, how many patients out of 10 comes to you of prostate, stone, cancer and others?
So my specialty being uro-oncology, so I basically don't see stone patients, I don't see stricture patients. So my practice deals with only cancer patients. So in my cancer gamut, I would say the 2 most common cancers which I see, or maybe 3 most common cancer in this particular area which I see are prostate, number 1. Second probably is bladder. The third one is kidney.
What are the most common lifestyle issues you see in the patients?
So lifestyle issues which lead to urological malignancies, which are specifically common to this particular area, are smoking habits.
Okay.
So very rampant history of smokers. I mean, if you see 10 patients of cancer in your OPD, 9 will definitely have an history of smoking at some point or the other in their life. Tobacco ingestion in any form. So again, you would have a positive history. If the person is coming from a rural background, there is a tendency of using tobacco, chewable tobacco. If it's from an urban background, there's a more tendency of them smoking. So these 2 things definitely lead to increased incidence of cancer in the as far as the genitourinary organs are concerned. The other factor which we probably cannot avoid nowadays is the environmental pollution, which is also leading to increased number of cancer patients. The third thing again, which is very unfortunate, but for West Bengal, we have arsenic in water. So there has been a lot of research on that, and the arsenic content as compared to the other parts of the country is higher in the groundwater of West Bengal. So you see certain areas like Midnapur where the concentration of arsenic goes extremely high. So this is linked with oral cancers, this is linked with bladder cancer. So the incidence of bladder cancers, particularly in this particular zone, is very high.
Okay. So, with the advanced technology and readily available information, has the relationship between doctors and patients altered?
The relationship would probably not depend upon the advancement of procedures or the technologies. The doctor, probably as a doctor's perspective, I can say that with the advent of newer technologies, I am much more aware of the kind of disease which I am dealing with.
Okay.
So if I'm able to identify the disease better, if I'm able to categorize the disease better because of the modern investigations, I am probably able to guide the patient better. I'm probably in a position to tell how his cancer is gonna be progressing or improving, in what context, in what manner. And once the patient sees that happening, and once the doctor is communicating and the exact same effect is happening in the patient, then the doctor-patient relationship becomes pretty healthy. The doctor is confident about the disease and the patient is confident about the doctor treating his disease well.
Okay, great. So the last question. How do you see the future of Indian healthcare sector?
See, as a business perspective, I would say, if I say I'm happy, the problem is increasing. So I would say I don't want to be happy on that aspect that the public is suffering or the incidence of cancer increases or the incidence of stones is increasing. The problem probably is going to rise because of certain of our habits, certain of our cultural habits, the geographic area where we belong to, the certain arid areas which are more prone for certain issues, the water content. So I believe in future, the technology which took around 10 years to come to India is probably going to travel faster. The younger population, the younger doctors are much more abreast to that and they are much more keen to adopt that. So I definitely see that in future, the surgical outcomes, the oncological outcomes, the overall medical outcomes, the overall surgical outcomes are definitely going to improve pan-India.
Okay, great. It was really nice talking to you.
Same here, ma'am.
And thank you so much for sharing your experience and thoughts with all of us. It was really nice having you.
Thank you so much. Thanks for having me. Thanks.